Hi, I'm Georgia. I'm one of the vets at Orange Vet Hospital, and today we're talking about what happens when your cat visits the vet. Today we've got little Gus here, and Gus is coming in. We find it helpful when cats come into the vet that they are restrained within a cat carrier so that we don't have any escapees through the car park or them stressed unnecessarily in the waiting room. We do have a dedicated area in the cat waiting area so that they can be separate from the dogs, and similarly, if they do need to come into hospital, we keep them separate from the dogs there too. Gus isn't too thrilled about this situation, but we have Felloway to help him keep calm, and we have Felloway going in the hospital to keep cats as calm as they can be when they come into the clinic. So Gus is here today for his annual checkup. And as part of our annual checkup, we check lots of things for cats. We focus on their weight and on their diet and make sure that that's appropriate for the cat that we're talking about. When we go through and examine the cats, we usually start at the front end and check what's going on for them. So for little Gus, he's got some aged little spots on his nose, but he doesn't have any discharge, he's not sneezing. We check his teeth and we'll arrange some dental care for Gus because he's got some dental disease happening there. His eyes are nice and clean and free of discharge, and we check that their pupils are symmetrical to look for any signs of neurological issues. Looking through his ears, nice and clean for little Gus, and he's got a little tattoo. You might notice a tattoo in your cat's ear, and we usually use that to signify that cats are desexed. When cats come into the vet, we expect that we're going to get fluffy, so don't worry if they put fluff all over us. When we're listening to cats' chests, we're checking that we don't have any abnormal breathing noises, that the heart rhythm is normal, and there aren't any signs of heart murmurs. We're also checking the heart rate to check that there's no troubles there. We check their limbs for any sign of pain, and that can be an early sign of arthritis or other trauma. Especially for male cats, we really focus on checking that the bladder and kidneys palpate okay, and for Gus that feels completely normal. He's not thrilled about his little legs being played with, but here we are. Often we try not to take the temperature of cats at the vet clinic unless they are sick or otherwise unwell, because most cats find it unnecessarily stressful. We want to try to make this experience as positive as possible for your cat and for yourselves.